The development of this podcast was sponsored by Alexion Pharmaceuticals Incorporated. The viewpoints expressed are those of the person speaking and not of Alexion. Welcome to NMOSD Your Way Global, an educational podcast series for NMOSD patients worldwide. NMOSD stands for Neuromyelitis Optica Spectrum Disorder, a rare relapsing autoimmune disorder of the central nervous system which primarily affects the optic nerves and the spinal cord. Your podcast hosts Lalania Lloyd and Debbie Latique, who have both lived with NMOSD for over 10 years, will be bringing their respective Canadian and Australian perspectives to the table in order to help patients worldwide better understand NMOSD. Over the next 16 episodes, clinicians, researchers, and fellow patients will come together to have important conversations about how to live your best life within your diagnosis. They will be offering up encouragement and practical tips for overall health and well-being. In this episode, Debbie talks with Dr. Therese Burke to get some advice that can help manage some of the physical aspects of NMOSD. So, let's get started.
Hello and welcome back, listeners. And hello, we've got Dr. Therese Burke joining us today, a specialist neuro-immunology nurse and researcher who has spent many decades looking into the ways people who live with challenging conditions like MS and NMOSD. So welcome back, Therese.
Thank you so much, Debbie. It's a pleasure to share the couch with you again today. Today we're going to dive a bit deeper into health and wellness and some of the symptoms around NMOSD and living well. But I just want to say up front, for anyone listening that's experiencing specific problems with their health, and particularly obviously with NMOSD symptoms, or they're worried about a loved one, they should immediately talk to their healthcare team and their GP in the first instance. But we'd like to cover some more general knowledge today.
Fantastic, thanks. Whilst everyone is different, living with NMOSD can interfere with daily activities. What can be done to develop a strategy to manage your symptoms effectively?
Yeah, well, so much of this, Debbie, depends on the types of symptoms that you're experiencing. As we talked about in the last episode, there's a full gamut of things that could potentially happen with someone. But overall, it's really important to look at a holistic approach, which is taking in the whole person and managing health and wellness. And part of that fits into taking back control that we talked about in the last episode. But I think central to this is doing a very person-centered assessment and having an individualized plan about what's important to you. So what your goals are. As you mentioned last episode as well, you were very specific in what you wanted to get back to and what you wanted to do. And so you set your goals up towards that. And I think that's important for people living with NMOSD across the board. What's important to them, what their goals are, where they want to be and what they want to do and what they want to achieve. And then coming up with a management plan that's going to suit that. But overall, an important part of health and wellness on the journey is maintaining brain health. And this covers so many areas where you can have an impact. You can have a really positive impact on your own health and well-being. And this is looking at things like diet and nutrition, looking at exercise and the importance of exercise across all facets of neurological care. You know, there's been some fascinating research in the last few years that shows the benefits of exercise across so many of the symptoms in NMOSD and in MS. Things like bladder function are greatly helped by exercise. Cognition, issues with cognition and memory and thinking can be greatly helped, as well as the things that we more traditionally associate with exercise, like cardiovascular and mental health and things like that. Doesn't always have to be running around the block. There's lots of different types of exercise that can be implemented, and sometimes with the help of an OT, an occupational therapist, or a physiotherapist to get what's right for you and what your abilities are at the time. But there's also important areas of brain health, such as stress management, making sure your sleep hygiene is the best it can be, looking at your cognition, monitoring your own NMO, looking out for side effects, making sure you're turning up for all of your appointments, making sure you're having your follow-up tests. Also looking after all the other things that happen with you, and also in preventative care, because it's really easy when something happens so suddenly to you and it's so all-encompassing with your health to forget about the other aspects of health. And these are things that we do as preventative health, such as for women mammograms and pap smears, and for men having prostate checks, skin checks for everybody. It can be really easy for those sorts of things to fall off to the wayside when you're dealing with a chronic health condition, but it's really important that you take everything into consideration so that it can all be managed well and you can live your best life possible.
It's far too easy to blame everything on NMOSD, isn't it?
Correct. And for people that are newly diagnosed, I can't imagine the angst that they go through with every new symptom. So, if something happened and there was a tiny tingle in the little finger in the morning, just even that could be just from sleeping on your shoulder the wrong way and disrupting the nerve. But it could also be an early warning sign of an NMO attack. And so for people to have to, when they're newly diagnosed, try and work all that out is just impossible, firstly. And because there's no predictability about it or certainty, they can't know what is and what isn't a symptom. So that's why it's really important to report back to your healthcare team any sorts of changes, but also realising that there's some specific symptoms that we'll talk about in a little bit more depth today that can really impact on your health and well-being that we can give you some tips about.
I've occasionally heard the term brain fog from others with NMOSD that I can perfectly relate to. Can you explain what this is and how can we reduce this fogginess?
Yeah, so brain fog is an interesting one. You may have also heard it referred to as cog fog, and the cog in that is referring to cognition. So cognition is a complicated brain function, but it basically involves thinking, memory, decision-making, executive function, all those sorts of things. And although the incidence of issues with cognition or brain fog in NMO isn't as high as MS, which we would expect because MS does affect the brain tissue to a greater degree, about 22% of people with NMOSD can present with cog fog as one of their main symptoms. And it can be due to inflammation in the brain, and it can also be from lots of other things that impact on NMOSD, like lack of sleep and sleep deprivation. So there's multiple variables that can have an impact. And so it's important to talk to your doctor or your healthcare professional that you're seeing for your NMOSD, if it's a specialist, about things that can be done and whether you might need referral to a neuropsychologist early to give you some tips on how to manage specific issues that you might be facing. I'm interested, Deb, what sorts of things did you notice with your cog fog, with your brain fog?
Yeah, initially in my first attack I had memory issues. I couldn't remember the names of family members. I stuttered. I had speech difficulties. So that brain fog still comes on and off, and if I start to stutter, that's usually when my brain fog is starting to encompass me again. So
yeah, but there's some training that you can do too. All of the usual brain training things that people do. Some people take them up just because they've turned 40. So there's all sorts of fantastic brain training things that you can do that work just as well for these types of cog fog. And practicing using your memory, it's almost exercise, a form of exercise, just some mental brain exercise that you can do. Things like crosswords, Sudokus, finder words. For some people, it's crocheting or knitting or following a pattern, and for other people it's exercise where they might do repetitive types of exercises that they find really helps with giving them some clarity.
Some really good tips there. Now, energy levels can be a real challenge too, can't they? Do you know ways to help manage fatigue?
Yeah, so fatigue, and as you mentioned in the last episode, Deb, this just isn't tiredness. This isn't feeling tired at the end of the day. This is bone-crushing exhaustion. And it's unrelated to what you've done previously in the day, as you've no doubt found out. Sometimes you can be being very quiet that day, but your fatigue can be absolutely crushing. And other days you seem to have more energy. And about half of people living with NMOSD report really significant fatigue that impacts their quality of life. But the good news is that there is a lot that can be done. Sometimes there can be vicious cycles that happen with the symptoms. So fatigue might be caused by sleep deprivation, which might be caused by pain and spasticity at night. So it's important to get to the root cause of what might be causing the fatigue. Because if it's pain and we can manage the pain, we'll talk about that in a little bit more depth in a minute, that could be all that needs to be done in your case. So it's going to be different for everybody. So getting to the root cause of the fatigue, looking at all the issues that can be helped, like looking at sleep hygiene, using the bed only for sleep, not having a TV in the room, not looking at computers and phones before bedtime, sticking to a set time for bed. Small little things that can be done, but they can have a big impact on helping things overall. And an interesting one is the research into exercise, which seems counterintuitive. If you're absolutely bone tired, why would you want to get up and do some exercise? But studies have shown, particularly some excellent research in the last couple of years, how important exercise is to reducing fatigue levels in demyelinating conditions, and can be an excellent adjunct to having a management strategy to get you through the day, because you don't want your day to just you keep going until you can't go anymore, and that's your day-to-day. You want to be able to do the things that you enjoy and the things that you want to do, and that might involve pacing yourself and using some of these strategies.
And just because someone has a diagnosis of NMOSD doesn't mean you can't live a fulfilling life with all these strategies and tips that you're sharing with us.
Yeah. And I just wanted to say, Deb, sorry, I forgot to say that occupational therapists and physiotherapists can be an amazing source of help here. Particularly occupational therapists have training in energy conservation and managing fatigue, and they can have a whole raft of things that might help you with your individual situation. So don't be scared to reach out to other practitioners too for help.
I'm really interested in this next question about pain and learning to live with it. If I was to come to you with pain issues, what would you suggest, Therese?
Look, pain is one of the major symptoms of NMOSD and can be really debilitating for some people. There's all sorts of pain, Deb, so it's important to do an assessment to find out what the cause of the pain is, because that's going to dictate so much how we manage the pain and where we go from here. And it can be pain from an acute attack, say with optic neuritis, where the optic nerve is really inflamed and you can have lots of pain on eye movement, or it can be pain that is more related to spasticity, where the muscles are really tight and spasticity, often from spinal cord lesions that can happen in hands and legs and feet. So it's finding out what's causing the pain. Now, primary pain, or we have neurogenic pain, you may have heard it referred to, that's pain that's caused directly by the nerve damage from NMOSD. So where the nerves are damaged, you would expect that there might be disrupted signals going to the rest of the body that can be misinterpreted as pain, or it can lead to muscles tightening and becoming spastic, which is a real tightness, and that pain can be extremely debilitating. So it's important to relate it back to what that type of pain is. The second type of pain is quite different, and that's nociceptive pain, and that's pain more from a secondary cause. So, for instance, if you are having trouble with walking and ambulation related to a spinal cord lesion from NMOSD, you might find that you change your gait slightly. Did you notice that when you had?
Yes.
Yeah, obviously you need to change your gait to maintain your balance sometimes when you're standing up, because those messages to your legs just aren't going the right way. And so you might find that you tend to walk a little bit differently. And so that could lead to pain higher up on your back, in your buttocks, or an area like that, where it's just as a result of you changing your gait. So important to know the different types of pain. And of course, there's all different types of strategies depending on what that root cause is. So, for instance, managing spasticity and tightness pain, there's drugs that can be used, antispasmodic drugs that can be used for that. So it really does depend on that root cause. Sometimes sending people to pain specialists can be life-changing because they can look holistically at what might be causing the pain, and they have suggestions sometimes that are outside that initial realm of anti-inflammatories or antispasmodics, and they can look at different ways of managing the pain.
Fantastic. Thank you, Therese, for spending time with me on the NMO couch and sharing such valuable information with us. I think your practical ideas have been really beneficial for our listeners here today.
Okay, and I think the same advice from last time too applies, Deb. Be kind to yourself, be persistent, be honest, and if you're worried about anything, seek help early so that we can get you the help that you deserve. Thank you.
We hope you have enjoyed listening to this NMOSD Your Way Global podcast. For more information about NMOSD and access to support and resources, please read the podcast description. What you have heard in this podcast may not be reflective of your own experience and does not replace the advice of a healthcare professional. If you have any concerns or specific questions about NMOSD, please speak to your physician.